How does stress affect your seizure threshold with epilepsy? Have you ever wondered how stress impacts your seizures if you have epilepsy? Stress can actually lower the seizure threshold, making the brain more vulnerable to seizures. This is especially true when stress is chronic or prolonged, rather than just brief moments of stress. Chronic stress has been linked to increased seizure frequency and can even worsen existing epilepsy. Research shows that people with epilepsy who experience chronic stress, like ongoing life challenges, traumatic events, or persistent anxiety, tend to have more frequent seizures. Many patients report that stress is a common trigger for their seizures. This connection is not just anecdotal. Clinical studies have confirmed that stress plays a significant role in seizure occurrence. When we experience stress, certain brain regions involved in emotion and memory, such as the hippocampus and amygdala, become activated. These areas are also crucial in epilepsy. Chronic stress can lead to changes in these brain circuits, increasing excitability and lowering the seizure threshold. For instance, stress can cause the loss of specific neurons in the hippocampus, which may worsen conditions like temporal lobe epilepsy. Stress also triggers the releases of hormones like cortisol. Elevated cortisol levels can change brain electrical activity and increase neuroinflammation, both of which may facilitate seizures. Studies have found that people with frequent seizures often have higher baseline cortisol levels, indicating a direct link between stress hormones and seizure susceptibility. It's important to note that stress often coexists with mood disorders like anxiety and depression, which are also common in people with epilepsy. These mood disorders can further influence seizure frequency, making it challenging to determine if stress is the sole factor affecting seizures. Some research suggests that depression may mediate the relationship between stress and seizures. Interestingly, many individuals with epilepsy report being able to predict their seizures based on feelings of stress. This highlights the subjective experience of stress as a potential trigger. However, it can be difficult to separate whether stress causes seizures or if changes in the brain prior to a seizure increase feelings of stress. While acute stress might sometimes have protective effects against seizures in animal studies, repeated acute stress often leads to chronic stress, which is more likely to increase seizure risk. For those living with epilepsy, managing stress is crucial. Since stress is a common and modifiable trigger, adopting stress reduction techniques, like relaxation exercises, cognitive behavioral therapy, or mindfulness, can help reduce seizure frequency and improve quality of life. It is also essential to address any coexisting anxiety and depression alongside epilepsy management. These mood disorders can significantly influence how seizures are controlled and how stress is perceived. Because the impact of stress on seizures can vary from person to person, it is vital for individuals with epilepsy to work closely with healthcare providers. Together, they can monitor triggers and develop tailored strategies for managing stress and seizures. In summary, chronic stress can lower the seizure threshold in people with epilepsy by altering brain circuits, increasing neuroinflammation, and interacting with mood disorders. Effectively managing stress is a key part of comprehensive epilepsy care, helping to minimize seizure risk and enhance overall well-being.